Well, hello folks. I am day 34 in Bell's palsy. And so I had mentioned to some of y'all that I was going to try to keep y'all posted on developments and progress. And so that's what I'm trying to do today. I'll take my glasses off. You can see progress here. That's about as high as I can raise my eyebrows. The affected side of the face is the left side. Some people say the right side's affected too, but I think that's probably just birth, genetics. But anyway, the left side of the face doesn't work. A smile's a little bit better. You'll notice the left incisor right in there. I was able to see the left incisor sometime last week. It was the first time that I was able to see that tooth in a smile. So for that, it was kind of cool. Most of the pain that I had talked about last time has gone away. The pain on the back side of the skull is no longer pressure sensitive, and its reoccurrence is quite rare. The pain in the face, it's still a little pressure sensitive right here along the jawline, but as far as this will be pressure sensitive. It's no longer shooting shards of pain across the face like it used to. The left eye still tears quite a bit. It either tears all the time or it's dry and burns. But nonetheless, there has been some progress. 34 days in, and there are some things that I've learned, and I'll try to share that with y'all, sort of like a survival kit in the event that any one of your family, or in case if you happen to come down with Bell's palsy. If you're watching this video, you either know me or you're a Bell's palsy patient. And so I'll try to keep you posted on my development and what works for me. Number one thing is the use of a straw. Get a bunch of them because you're going to need it. Try not to even think about drinking straight from the glass or a bottle, especially if you're wearing good clothes, because it's probably going to spill everywhere. The next thing that you're going to need is a bunch of napkins. You're going to need that because you're going to spill stuff out of your mouth a lot. Another thing that I find myself needing that I didn't need before is some chapstick. I don't know why, but for some reason, my lips are dry. They've become dry. Even both sides of the one end of the mouth to the other. Go figure. Another thing that you're going to need, let me see if you can see it here, are eye drops. You'll need to go to your local drugstore and get some of these eye drops and keep them with you so that you can keep your eye moist. And probably the most difficult time will be while you're trying to sleep. Which brings me to the next item. You're going to need an eye patch. And this is probably well and good in its design, but for a Bell's palsy patient, you're going to need some additional equipment, such as some medical tape. Also use napkins and toilet paper. I folded up to make an additional super thick gauze. Just kind of folding it up like this, making it kind of soft. And I shove it back in here on the back side of the eye patch. And then I use it to put on the eye and then cover it with the medical tape. Because the eyelid, you don't have any control over your eyelid. And while you're trying to sleep, the eyelid may open, and that's what will cause your eye to become dry. And in the morning time, even with an eye patch, there are times that it may take 20, 30 minutes, if not an hour, to get the eye back to feeling normal. But anyway, there has been some improvement, and it's not the it's something that I wouldn't wish on anybody. As you know, it's called Bell's palsy. It's one of those medical mysteries um, that they just can't seem to solve. Now, most of the swelling has gone away. A lot of folks will tell me that they've noticed some of the swelling is gone. A lot of times they ask me, what is it like? Well, it's frustrating because you feel like you can't speak correctly. You feel like you can't pronounce words correctly. I'm constantly biting my tongue, constantly biting the inside of my cheek or my lips. Sometimes you burn yourself because the pain receptors and the nerve receptors here in the face are not working. So you have that to deal with. As far as the eye is concerned, well, if you imagine looking through a water bottle, that's probably the closest that I can explain or describe what it's like for the left eye from probably the lower half of the eye, the vision, that field of view is like looking through a water bottle. The rest of it up here is usually okay. And I guess that's because the tears will fall just simply because of gravity. So if you're trying to read anything, if you're trying to do any kind of work on a computer or do anything on your desktop, you can kind of forget about it. And you have to use your right eye a lot. But anyway, so other than that, there have been some improvements. Like I said, I'm day 34. And other than that, we'll try to keep you posted. And that was my cat back there. That was our cat, Sassy. He's about 14, maybe 15 years old by now. I was hoping that his brother Simba would come in here so I could show you all what our Simba looks like. Anyway, there he is back there again. Anyway, I'll keep you posted on the next development. See ya.